Unlike the three wonderful speakers before me, I'm not a physician. I've never worked in a hospital, and I know nothing about blood testing. So in sum, I'm an imposter, okay? And it's a wiki sport that I'm here. I'm a social scientist, so I study human behavior. And when I was preparing for this talk, I reflected on my research journey, especially my research in the area of online communities. And I realized that there's a shift of my research focus in the last 10 years or so. I think this shift actually kind of mirrors the public perception toward the internet in general. So in the early days, as you know, the internet was held as this great tool that can democratize information, can unite humanity, can bring people together, can provide access to the information and knowledge that's previously not available for those people, especially those underserved people. But I think in the last 10 or 20 years or so, I think the public perception toward internet has changed in a way. So we're taking a more critical and cautious view of the internet, and to see it as a double-edged sword. It can bring up good things, but also it can cause lots of problems. Right. So I think again, my research and my thinking about online health communities somehow mirrors that kind of a transformation. So I'm going to talk about the good side and the bad side, and the ugly side of online health communities based on my research. Okay, so I guess the word community often evokes that kind of sense of that warm and fuzzy feeling of togetherness, the sense of belonging, right? The sense of togetherness, the sense of being part of a collective whole, right? And I think numerous studies in the past, especially in the area of online health communities, have demonstrated that these online health communities are really good for supporting people with long-term conditions, with chronic conditions. They're able to provide information and emotional support to those people who are not able to get from like a 5 minutes, 10 minutes consultation with the doctors or nurses, right? So, one of my papers, for example, showed that if you, as an online health community user, if you develop a certain kind of community attachment to that virtual community, your participation in that community would help to improve your emotional well-being. Okay? So again, this is a very much kind of established kind of understanding of the good side of online health communities. Okay. But we know that the impact of online health communities are not always positive. Right, so there are many negative sides that has been discussed in the literature, and what I have focused on is the impact of online health community on the patient-doctor relationship. Right, so in a more recent paper, my co-author and I looked at how one of the largest online community for people with diabetes, how being part of the community actually impact how the patients actually interact with doctors. Yeah, I think we have found evidence that by joining on and being active in this kind of online health communities, it could lead to an erosion of trust in medical professionals, especially if the information the patient gets from these communities actually contradicts or not entirely aligned with the doctor's advice, which can bring up frustration and suspicion among these patients. And the online health communities can also complicate the communication between the doctor and the patients. Sometimes the doctors will feel that they are not really talking to the patient in front of them. They're actually talking with a collective of patients, right? Because this particular patient has get information from the online forum. They sometimes even bring the printouts with them and show the doctor saying that, this is what I read from the online forum, can you tell me whether this is true or not? Can I follow this particular diet, or can I follow this particular, experimental kind of treatment? So it complicates the communication. And if there's suspicion, frustration, and a perception of lack of empathy and understanding from the doctors, those patients could fail to follow the treatment advice from the doctor, which would potentially hinder the effective care. Right? And those are the quotes that I extracted from the paper. So oftentimes, as I said, patients go to a doctor, and they've been to online health forums, read all kinds of posts, and they will say, I have read on the forum about that, right? The conversation sometimes starts with that. And the second quote here from individual that had the type 2 diabetes. So he went to see the nurse, and he was telling the nurse that by following a low-carb diet advocated on that particular online forum, he was able to reverse the diabetes, lower the pressure, lower the cholesterol, etc. But the nurse kept telling him that you have to have carbohydrate in your diet. You can't really follow that kind of low diet, low carb diet. So this patient got very frustrated. So he said, I just agree to disagree, right? So I just simply, because I know you're wrong and right, so I just got up and walked out. So that's maybe one of the extreme cases, but we have seen lots of examples where the patients, again, not really have the full trust in the advice from the doctor, simply because he or she has been active in these kind of online forums. And the last quote is also quite illustrative here. So those patients, especially those patients that had long-term conditions, they will become what we sometimes call the expert users, right? In these online forums, they're able to provide advice and help to other people on the forum, and they believe that their life experience actually, if not more valuable, but equally valuable, right, for the treatment and for the health self-management. Okay, so that's what I would call the bad side of online health communities. But I think that through a proper, patient engagement, from proper medical staff training, we might be able to mitigate this kind of impact, right? To train the doctors and nurses how to react in such a scenario where a patient come to you with a set of information from the online forums or from the social media. But I think the next problem, which is much more difficult to mitigate or to deal with, right, which is the health misinformation. So that's health misinformation is rampant online, on social media or online forums, and especially on forums like Reddit, which is quite popular. There are many medically themed subreddits on Reddit, and there are many thousands of active users of this kind of forums. There's so much misinformation out there, and there's just no way for us to control the spread of misinformation in these forums. I think this is a very acute problem, and I don't think the current research has found a solution yet, or even a toolkit of things, right? So because of this, by the way, when I was searching online, I found NHS Berkshire Healthcare actually has compiled a wonderful webpage with beautiful documents telling people don't entirely trust the information found online. So the misinformation problem is difficult to counter. There are numerous efforts tried in the past, from the pre-information exposure filtering and to like post-exposure fact checking, right? So this measure has been employed in the past, but it has very limited success, right? Partly because, or mainly because that the volume and the velocity of information being generated online. So in a forum with thousands of users, the speed of the information generation is really fast, and is you're always playing the catch up if you're a moderator or you're trying to moderate the conversation. Previous research has also shown that the medical professionals and the expert users are really reluctant to be part of this misinformation kind of countermeasure. First, because of time, right? So I think previous speakers already mentioned that the medical professionals are overworked and they're underpaid. They don't really have the time to deal with this kind of misinformation online. But the other factor is that many of them actually don't really have the motivation to do so after they have tried. Previous research has shown that those people who have tried to combat misinformation online often got bullied by the trolls. They found it's very stressful by posting online and got attacked. So they just give up, right? Just give up. And lastly, this is probably more relevant to today's theme. Okay? I promise I'll get to AI. So the recent development of large language models, of course, has exacerbated the problem, because now the information is much easier to generate and much easier to spread online, okay, because of these AI tools. Okay, so as a baby step towards solving the problem, I recently got a small grant from another Network Plus, not this one. I wish I got one from you as well, but from Sprite Plus. So I and my team are trying to look at the misinformation intervention and countermeasures for health advice, or MICA. So our long-term goal is to create autonomous AI agents that can monitor and counter health misinformation on social media through, here's the key, through authentic and human-like interaction with users. Okay, so this is not just another chatbot that, at least as we have envisioned. So this is going to be a AI user that lives in that online forum, okay, and having conversation with the users, okay, and monitors the conversation and provide the natural language kind of responses to correct or to guide the conversation. Right? So we know, I mean, the whole idea is based on some assumptions or our understandings about the online health community's dynamics. We know that fact checking doesn't work. Okay, doesn't work, and we know that the best way to counter the misinformation is to do what we call social correction in local conversation context. Okay? So we're not trying to create another chatbot to ask people to go there to a different place to get health advice or correct information. We actually trying to embed that health chatbot within that online forum to again guide and monitor the conversation. And we call it benevolent bots. And we are trying to argue that AI can also be good, can also serve the good purposes. We are currently only the very early stage of the project. We are currently doing a systematic literature review to see what has been done in the past in terms of using AI to counter misinformation. We are also doing a landscape analysis to see what's out there, in the healthcare industry and the information technology field to see, what kind of measures have been commercialized or being employed in the real world. Yeah? And following that, we're going to do a survey and a series of online workshops to talk to online health forum users and to see, what kind of benevolent boards they want to see in these forums. Now, for those of you who have looked at online forums, you will know that by introducing something like that into the online discussion, you can potentially, change dynamics of the interaction. you can potentially do bad than good, because the trust, okay, of the community has been built in a long time by interacting with real users, right? By introducing artificial intelligence agent into the forum, will you actually change the dynamics and trust in that forum? So we don't know yet. So this is, again, as I said, is the first kind of baby step towards solving the problem. We're hoping that we can find encouraging evidence to show that this kind of solution can be employed, in online forums to help mitigate this misinformation problem. Yeah. So this is my team, and as you probably can see, they are all social scientists, okay, just like me. So we are. I'm taking this opportunity kind of to pitch the project, and then if you want to talk to me about this, for example, if you happen to know a CEO of an online health forum kind of community company, please do talk to me. And if you're interested in solving the problem of misinformation online, talk to me. I'll be more than happy to talk about a potential collaboration, because we are, as a promise to the funder, I don't know if you do the same. If you get a Network Plus grant, you're kind of obligated to develop a larger grant after that. So that's our next step. And I think that's for me.